Hi, this is Dr. Sutton with MDI Prep, and today's message is very simple. We're going to be talking about something that may impact you, your family, those around you, and it may be something you might find on your exam. Today we're going to be talking about the ACE inhibitors. Now, most people may say, what in the world are you talking about? Well, the best way to explain an ACE inhibitor is, first of all, to tell you the names that they go by: lisinopril, captopril, enalapril. All those things that end in PRIL are ACE inhibitors. So a young man comes into the office, he's 36 years old, and he's asking his doctor, hey, doctor, I don't know why my blood pressure is elevated. And the doctor says, well, there are several different reasons. One reason may be, imagine this young woman from Ireland. Her name is Angie, and her last name is Otenson. Angiotensin. And he says angiotensin decides, and she's going to come, and she's basically taking up residency in your body. And what is she doing? Well, she's doing something. Her name is angiotensin. So she's tensing up your blood vessels, making your blood vessels more tense, right? And that's going to increase your blood pressure. The other thing that Angie is doing is she's cooking inside the body, and she's cooking with a lot of sodium, which is going to increase your blood volume, right? So that's also going to increase your blood pressure. So the young man is saying, wait a minute. So why is angiotensin doing all that? The doctor says, well, it's not really her fault. She has a cousin named ACE. ACE, angiotensin converting enzyme. And the whole purpose of ACE is try to convert angiotensin from that nice young lady that she is to someone who's increasing your blood pressure through making your blood vessels more tense and increasing your blood volume. So the young man says, okay, I get it. So you mean the way we can decrease my blood pressure is by blocking ACE? The doctor says, you got it. Exactly. We can use those things called ACE inhibitors: lisinopril, enalapril, captopril. Those are things that can basically block ACE. So the young man says, perfect. I'm glad I can decrease my blood pressure. Doctor says, yes, but we got to tell you something first. Possibly, but not everyone gets these side effects, such as you may get a cough. Young man says, oh, no problem. Cough, I can deal with a cough. He says, yeah, but there's something else. You can also develop what they call angioedema, which you can get some swelling around the face. He says, wait a minute. So you mean if I take this drug, right? If I take this ACE inhibitor, I could possibly get swelling around the face? He said, yeah, but it doesn't happen with everyone, and it's something that can be reversed. He says, okay, that's fine. He said, well, one more thing I got to tell you is that you can also develop some renal issue if you already have some pre-existing renal conditions. He says, whoa, wait a minute. So you mean my kidneys can shut down? He says, it's possible, but it doesn't happen with everyone. He said, because you're a young man, you don't have to worry about pregnancy. Now, if you were a woman, then you would have to worry about pregnancy, because this is not something we would want to give a woman who was thinking about having a baby. So the young man is weighing all the different things, right? And he's saying to himself, I got all the information. I know what's going on. I know how to handle that information. And he asked himself a question, which a lot of us ask ourselves after we've gone through something, whether we met an obstacle, whether we failed an exam, whether we've done something where we've met some adversity. We've asked ourselves this two-word question: now what? If you've ever faced an obstacle, raise your hand. If you've ever failed an exam, raise your hand. If you've ever made a mistake and you try to figure out how to correct that mistake, raise your hand. I know I have. Today's message in our series is based on a question that we've often had to ask ourselves. And it's a two-word question. And that question is, now what? Yeah, we failed before. Yeah, we struggled. We've made some mistakes. We've done some things that we shouldn't have done that kind of hindered our path to success. But every time we meet those resistance, those things that we come against, what do? Do we quit? Do we give up? No, we ask the question, now what? The ones that really make it, the ones that overcome, are the ones who can say, now what? And they put some action behind that now what.